Hello there. Health Spa is on your screens again to talk about one important health issue, that is HIV and AIDS. It is estimated that there are 330 million episodes of STIs annually worldwide. Over 50% of the infections occur in young people. According to the HIV Sentinel Survey report in 2014, the national median HIV prevalence, which almost established at 2.1% for the past three surveys, after a decline from 2.9% in 2009 to 1.6% in 2014. Factors contributing to HIV infections in adolescents: 1. Early sexual activities. 2. Multiple sexual partners. 3. Rape. 4. Peer pressure. 5. Substance abuse. 6. Economic hardship, which may lead to sexual favors for financial support. 7. Lack of information, education, and life skills. 8. Lack of adolescent friendly health services. How is it transmitted? An HIV infected person is capable of transmitting the infection through unprotected sexual intercourse with other people, through blood and blood products, example, transfusion of contaminated blood or blood product, and sharing contaminated cutting and piercing instrument, example, needles for injection, circumcision knives, and blades. An infected woman can also transmit the HIV to her infant during pregnancy, labor and delivery, or after birth through breastfeeding. HIV is not spread through everyday social contacts such as shaking hands, living together, playing together, eating together, or hugging, and not through air, food, or water. Articles of an infected person, such as cups, spoons, and clothes. It is also not spread by sharing toilet seats or bites of insects, example, mosquitoes. Most symptoms present during HIV infections: fever, vaginal or urethral discharge, which may be accompanied by genital pain and swelling, urethral discomfort or urination, scrotal pain, genital ulcers, enlarged lymph glands, lower abdominal pain. General signs and symptoms of HIV infections. In this, we have two: we have the major and the minor. In the majority of the cases, the infected individual may not show any sign or symptoms. However, persons who progress to develop AIDS show some signs and symptoms, such as, which is the major signs and symptoms: persistent diarrhea, unexplained weight loss of more than 10% of body weight, prolonged or recurring fever for more than 1 month. Now, the minor signs and symptoms: persistent cough for more than 1 week, generalized itchy skin diseases, white patches in the mouth and throat, enlarged lymph glands, loss of memory, loss of intellectual capacity, profuse vaginal discharge, severe herpes zoster infections, that is, recurrent. The consequences of HIV among adolescence. STIs are more severe during adolescence than in adulthood. They are not only a cause of acute morbidity, but also may result in complications such as infertility, ectopic pregnancy, urethral structure, cervical cancer, congenital syphilis, fetal wastage, low birth weight, preterm labor and delivery. What are the consequences of HIV infections? After years of slowly declining immunity, about one third of infected persons may become symptomatic. When the immune system is completely damaged, one or more of the instinctive sets of opportunistic infections arise. This includes tuberculosis, a type of skin cancer, cryptococcus infections, which affect the brain, and pneumocystis carinii, that is a type of pneumonia. Management of STIs and HIV infections. Management of HIV infections. Testing and counseling, that is the TC, ensures that counseling is incorporative into HIV testing. This reduces the likelihood that when the HIV infected person is told of his or her positive status, he or she would not act irrationally. Medical care. A combination of drugs are used to manage HIV positive clients. The health worker should treat patient or client with compassion, counsel client to learn how to live with HIV infection, ask client weight loss, prolonged cough, fever, diarrhea, if any is persistent, manage appropriately. Educate family members on preventive measures, counsel clients against donating blood, refer when there is any necessary occasion. HIV or AIDS patients can live long life when taking serious on their drugs. When they take their drugs very, very seriously, they can live their life very long and enjoy life. But if they don't, their life is very shortened and they can end their life any moment when stopped taking their drugs consistently. To avoid being transmitted to your infant, abide by the clinician with ways and how to take your drugs consistently to avoid spreading HIV or AIDS. HIV or AIDS is real. HIV or AIDS can kill. HIV or AIDS patients can live long life. Protect yourself, protect one another. Let's fight against HIV or AIDS. This is Health Spa. We are open for more topics and more questions. Let us know your topic and we'll dive on it. Thank you.